Hello everyone. Today, we will be discussing an important topic, hypertension. Hypertension, often referred to as high blood pressure, is a common health issue, where the blood pressure in your arteries is consistently high. When this happens, your heart has to work harder to pump blood, which can lead to long-term health problems. So, what's hypertension? 1. Overview of hypertension. Hypertension is a prevalent disease worldwide, affecting over 1.6 billion people and constantly increasing. The control rate of the disease remains low, leaving severe consequences on patients' lives. 1.1 Understanding blood pressure index. Blood pressure is the force created when the heart contracts and pumps blood through the arteries. High blood pressure occurs when the force exerted on the blood vessel walls is higher than normal, meaning the heart has to work harder and the blood vessels are under greater pressure. This is a major risk factor for heart disease, stroke, and other serious illnesses. In medicine, this high blood pressure condition is commonly referred to as hypertension. Your blood pressure reading consists of two numbers, one above the other. For example, 148 is. The higher number, systolic blood pressure, reflects the pressure inside the arteries when the heart is pumping blood. The lower number, diastolic blood pressure, reflects the pressure inside the arteries when the heart is relaxing between beats. The unit of blood pressure measurement is millimeters of mercury mmHg. A high blood pressure reading once does not necessarily mean you have hypertension. Our blood pressure changes throughout the day. When you are anxious, stressed, or have just finished exercising, your blood pressure may also be higher for a short period of time. When you sleep or relax, your blood pressure will drop to a lower level. 1.2 What are the symptoms of hypertension? The majority of people with hypertension are often unaware of their condition until dangerous complications such as heart attack and stroke occur. This is why hypertension is often referred to as a silent killer. Hypertension can only be detected by regular blood pressure measurement, or when visiting a doctor for other reasons and having blood pressure checked at the same time. Sometimes, when blood pressure is too high, you may experience headaches, dizziness, and blurred vision. In addition to high blood pressure, a physical examination by a doctor usually does not reveal any other signs. If high blood pressure has been present for a long time, or is very high, it can also cause changes in the blood vessels in the back of the eye, leading to symptoms of blurred vision. 1.3 How is hypertension diagnosed? You will be diagnosed with hypertension if your blood pressure readings are consistently high over multiple measurements, taken at different times, and remain high even when you are relaxed or resting. Hypertension is diagnosed when blood pressure readings are recorded at 140/90 mmHg or higher when measured at a doctor's office or hospital, or when the average of recorded readings is higher than 135/85 mmHg when measured at home or with an ambulatory blood pressure monitor. If these blood pressure readings remain high above the mentioned thresholds, you have hypertension. If your blood pressure is only high on one occasion, and the reading is not too high, your doctor will not diagnose you with hypertension yet. The doctor needs to base the diagnosis on the average of blood pressure readings taken at home, or with an ambulatory blood pressure monitor. People suspected of having hypertension are often encouraged to record their blood pressure readings when they are not at a doctor's office or medical facility. The reason for this is that some people feel anxious when visiting a doctor, which is also a factor that contributes to high blood pressure. This is called white coat hypertension. Therefore, measuring blood pressure at home or using an ambulatory blood pressure monitor will record your actual blood pressure readings when you are relaxed and less anxious. 1.4 Why is high blood pressure a problem? Hypertension is a risk factor for serious health problems in the future. If you have high blood pressure for many years, the walls of your blood vessels will gradually become damaged, and your heart will have to work with a heavy burden on it constantly. In general, the higher the blood pressure, the greater the risk of health problems. The greatest risk associated with high blood pressure is cardiovascular disease, including heart disease, or the entire blood vessel system caused by atherosclerosis. Atherosclerotic plaques are like small fatty deposits that form between the layers of the blood vessel artery walls. Atherosclerosis causes the walls of the arteries to become increasingly thicker, stiffer, and less elastic. Cardiovascular diseases caused by atherosclerosing, angina pectoris, heart attack, stroke, transient ischemic attack, peripheral artery disease. Hypertension is more common in people with diabetes, both type 1 and type 2. However, it is more common in patients with type 2 diabetes. Family history of hypertension. High-risk diet and lifestyle, specifically overweight, obesity, eating salty, high-sodium foods. Sedentary lifestyle, not exercising. Drinking a lot of alcohol, high stress. 1.5. How to measure blood pressure correctly. The first blood pressure measurement is usually done at a doctor's office or medical facility. If only one high reading is recorded, the doctor and nurse will usually advise the patient to self-monitor and record it for a period of time. This means that blood pressure needs to be measured multiple times, at different times, and spaced apart by a certain amount of time. How often you monitor your blood pressure depends on your initial blood pressure readings and the health risks you may have. 1.6. Home blood pressure readings. Your doctor may recommend that you buy a blood pressure monitor to proactively monitor your blood pressure at home. Blood pressure should be measured when sitting and resting, relaxing at home, using a standard blood pressure monitor. You should measure twice a day for a week. From there, you have 14 systolic blood pressure readings and 14 diastolic blood pressure readings. Then take the average of the 14 systolic readings and the 14 diastolic readings to get the average blood pressure reading. It is normal for blood pressure to vary or change between readings. So if your blood pressure reading is high, but not too high on one occasion, you don't need to worry too much. 1.7. Ambulatory blood pressure readings. These are blood pressure readings that are automatically recorded at regular intervals of every 15 or 30 minutes. While you are still going about your normal activities and work, you simply wear a small device with a wrap-around arm cuff to measure blood pressure readings, usually for 24 hours. The average blood pressure reading recorded by an ambulatory monitor is the most accurate reflection of your blood pressure status. If you do not have an ambulatory blood pressure monitor, you can substitute by measuring your blood pressure multiple times at home. Blood pressure readings taken with an ambulatory monitor and at home are usually lower, sometimes much lower, than blood pressure readings taken at a doctor's office or hospital. The reason for this is that we tend to feel more comfortable, relaxed, and less stressed when measuring blood pressure at home. 2. How to treat hypertension. The principle of treating high blood pressure is to monitor blood pressure regularly, treat it correctly and adequately, and for the long term, to achieve the treatment goal of bringing blood pressure down to 1/90 mmHg and minimize cardiovascular risk. 2.1. Using medication to treat hypertension. There are many different types of medications that work through different mechanisms to regulate blood pressure more stably. Therefore, your doctor will advise the most suitable type for you. If the drug is not yet optimal, or if the drug causes side effects, you still have many other drug options. The ideal is to find one or a few medications that are suitable and control your blood pressure well. Once you have found the right medication, you need to keep taking it for a long time to make sure your blood pressure is under control. Self-discontinuation of blood pressure medication can cause blood pressure to rise out of control. Organs continue to be damaged due to prolonged high blood pressure, and the risk of serious complications is not reduced. And another indispensable thing is that you need to check your blood pressure regularly during treatment, and see your doctor regularly for adjustments if necessary. 2.2. How to cure high blood pressure without medication. Making changes to your lifestyle, activities, and exercise can sometimes be very helpful. And in some people, these changes may even help them not need to take medication. Specifically, combine with healthy lifestyle adjustments. Build a healthy diet with nutritious foods such as vegetables, fruits, whole grains, meat, fish, and limit the use of foods high in sugar, fried foods, and do not add too much salt to food. Increase exercise to improve resistance. Maintain a healthy weight. Control stress, anxiety, keep mind stable. Limit the use of alcoholic beverages, caffeine. Quitting smoking does not lower blood pressure, but smoking combined with high blood pressure increases the risk of cardiovascular disease. So, if you quit smoking, you will reduce your risk of stroke, heart attack, etc. Once again, thank you so much for watching this video, and I'll see you in the next one. Take care, and have a fantastic day.